Hi there! Before we get started, a friendly reminder. The information discussed on this podcast is for entertainment and informational purposes only. While our guests are knowledgeable in their respective fields, your personal situation may require unique guidance. We encourage you to consult with a qualified professional for personalized advice. Now enjoy the episode. Hello and welcome to today's episode of AndWon Should Know, where we journey together with you to find tips and tricks to better your health journey. Today we have Veronica Yap with us.
Hi.
Welcome. Welcome.
I met this wonderful human being some years ago when I was having a lot of problems with my health. In particular, I was hiving a lot. I would get hives whole body from my head to my toes. I had a lot of eye swelling, lips swelling, and it led to a point where my entire left face started to freeze, so I had no use of my left face. I went for an MRI and then we found that I had a brain aneurysm. So it was this wonderful lady that actually helped me to gain movement in my face again, because it was quite important that we not allow the nerves to die off, right?
Picking up on your story, we had to work very intensely for her because we had to try to restore it in as quick a time as possible, because there's always a window and we have to get everything sorted out, fluids to move and muscles to function and the nervous system to reconnect back. Because the inflammation was at such a point that it sort of pushed everything into a frozen state. And I never knew that would happen until we come across patients like that we never knew that inflammation and swelling can be at such a state. So I went through the same thing. I became frozen myself for about a year when my inflammation kicked in, and I have my own lymphatic journey that started me off on a deeper search for answers more than ever. Even though I had done a lot of training, I was triple certified by Lymphedema schools, 3 different Lymphedema schools, not the same as the SPA schools. So basically, these are medical syllabus. You'll find us in the hospitals, public health and private health. It's a very different level of game altogether because lymphatics covers all of the fluids. 90% of our body's water is lymph, 10% is blood. So everything that's preceding the event, like your aneurysm, for example, there will be a lymph enveloping that area already. That signifies that area is going down before the actual event. Like it can be a few months to a year or more than that before it actually appears. So if you randomly check, you actually see it.
So a lot of peri and menopausal women especially talk about a lot of bloatedness that's happening with them or within them. Is it also about their lymphatic system being blocked?
Yes, kind of. When you come to the lymph as a subject, it's very touchy. So basically, the lymph is a big princess, serious princess. So it's one of those kind of thing, everything very unhappy.
So we call that being diva.
Yeah, okay, that's the word. Yes, a super diva princess type. So basically, if you have too much hormones, too little hormones, menopause, pregnancy, puberty, all of that can trigger a lymphatic evolution event. So when I was pregnant, I had a lot of swells and I thought it's just water retention. It went away because I was fit, I was healthy, I was very active. And then as time passes, it comes and goes, it comes and goes. And then by the time it comes and it doesn't want to go, then you're like, this is very suspicious.
What is Dergams?
It's actually adiposity dilarosa, adiposity meaning fat, dilarosa meaning rose. So it's rose-colored fats, meaning to say your fats are on fire.
Oh.
That kind of inflammation.
Your fats are on
Yeah,
fire.
the fats under the skin. So it's another classification of lymphatics. It's another type of lymph subset. It's a lipidema disorder. There's so many types.
Dergams.
And they are the fat-resistant group. So they are the people with swollen fat disease or painful fat disease, because when it flares up, it turns red. Under the microscope, you can see a ring of red around the fat tissue.
Wow.
And it's so terribly painful. Yeah.
And who are more susceptible to Dergams?
Yes, a lot of people are actually, for female population, 11% in the UK's research are actually pronounced with lipidema, and Dergams is a subset of the lipidema. population. And you will see people like that with lopsided body proportion, very big hips and thighs or arms, very small trunks. They're very sensitive to touch, very tender, bruises easily, poor immune system, fatigue a lot, sleep is never enough, the energy is just very low. A lot of joint pains because the inflamed fats are actually on top of their joints. So it seems like arthritis, but it's not. All the scans comes back normal. And then they are on all kinds of painkillers that doesn't help.
So where do you get your source of protein then? Because when you're menopausing
Yeah.
or you menopaused, you lose muscle mass and you have to take protein.
Okay, that's a
you
lie.
Ah!
So that's a lie. So you don't need that kind of protein. So usually you have enough. So we are not in a third world country where we are starving. So that's it. We have sufficient food. So I've been vegan for a year now. This is my 1-year anniversary. And I didn't lose weight. So you can see that my weight is the same. My muscle mass is the same. And I am well menopaused, in my 50s already. According to Dr. Vichai Kataksin and his research, as he's a hepatologist, he's a liver specialist in his previous life before lymph. So essentially, you don't really need excess protein from animals or material. So animal material protein, not necessary, including eggs and dairy. So essentially, your body produces 60-70% of the protein that you need. So if you need proteins injection, it's usually because your liver is failing. And that's the point where proteins are actually really necessary, albumin especially. So other than that, when I eat all the vegetarian, vegan diet that I'm eating, the plant protein from soy, from legumes, from beans, from nuts are sufficient. And I didn't even lose any muscle mass or weight. I wish I do. But like I said, we really don't need. And then when you say that muscle mass, it's actually exercise. It's actually about weightlifting. It's actually about going to the gym. It's about
Exercising.
making it work.
Lymphedema has a lot to do with post breast cancer surgery, right? And that is your specialty.
Yeah.
Tell us more about that.
So about 80 to almost 90% of my patients are actually cancer-related lymphedema, and I have like maybe 10%, about 10% of them which are primary lymphedema, which are genetically formed, which is another topic altogether. When you have cancer surgery, lymph nodes are taken, radiation is piled upon it. You will get scarring of your lymph nodes or your lymphatic system, or your lymph nodes are removed. Your lymph vessels are actually fried by the radiation, and the scars over it. So you kind of choke your transport system. So just like can I use the current situation we have, the Jurong,
Yes.
MRT lines, or the lymph nodes. So the lymph nodes are taken away. So you have congestion, traffic, everybody's chaos, right? So, but you have the buses on the superficial lines, right, above the ground, and they take the people away slowly but surely, yes. But if you imagine that somebody bombed the superficial lines with radiation, and then the deep lines are also not functioning, yes, you can get transport, people can still walk, but still it will be really, really slow. You will have a pool of people at the exit, at the MRT, causing a riot. Let me in and let me out, and that will be the accumulation, and you will consider that as lymphedema. That accumulated riot of people, a body of people gathering around the stations and transport lines that cannot go anywhere, cannot go home, getting really angry and hot.
Yes, that's lymphedema.
That's lymphedema, angry and hot fluids and swollen. There you go.
Because the lymphatic nerves are basically cut off.
So lymph nodes are cut away. The lymph ducts and lymph vessels are still there. They're still doing their job bringing in. So these are people clueless. They're still go to the traffic and add on to it,
Right.
And then they get stuck there and they're like, I can't go home. And then, and these are the things that happens to a regular person. So your lymph will still be produced. Your lymph fluids are still circulating, but you cannot take it away with the lymph vessels, the lymph ducts, the lymph capillaries, which had been scarred by radiation, the lymph nodes, which has been taken out, evacuated, and tissues that has gone through surgery, that has scars. So there's are a lot of roadblocks, a lot of down traffic lines.
And so what do you do for them then?
So
How
when
do you
we
help them?
do it, we will have to reroute. So when we reroute them, we actually try to take the traffic from there and we evacuate. Okay, here, this is the other way. Go to the next line. Go to the closest functional lymph line or functional train station. There you go. Then you can go on your merry way. So that's what we do as a lymphedema therapist. We actually divert the traffic to the next functional line.
How? Through
Through
massage?
therapy, through massage, through compression bandaging. So a lot of the things that the Thais do in the Thai center, they use ice to reduce the traffic, to reduce people from coming. So to cool down the heated riots, to come down now so that you can find your way home. So because if you are swollen, you are bloating up, you are swelling, you become bigger than usual. And then the next thing is you're hot. You're hot, and then you are adding more stress to it. You're adding more fluids to it. You're adding more flow to it. Traffic is getting bigger and bigger. And then everybody is just gathering there being angry.
This just sounds like menopause.
It kind of is.
Where you get hot and then you get
kind of
angry.
is. So it kind of is. So when you menopause, you do actually have a bit of a lymphatic problem.
Yeah, no, I just also wanted to ask because what I understood of lymphedema and the lymph nodes is that it actually helps to take the toxins away from the body. So I guess when you do have a traumatic medical experience, I guess that would block it, which then will kind of get it to that's the reason why you get lymphedema, right? Is because
Yeah.
you're no longer able to actually
You lost your lymph nodes.
your ability to push out toxins.
You lost your ability to filter, and you've lost your ability to suction away the fluids.
Right.
So you've lost your lymph nodes, and then your lymphatic transport system becomes poor or even dysfunctional.
Okay.
Yeah, so that happens even as we age normally. So we do have edema as we age-related lymphedema, age-related edema.
Are there any symptoms though that people should be looking for right off the bat to be like, okay, I need to go see Veronica to see if I've got lymphedema?
Okay, so if you swell for no reason and daytime, you start to feel heavy, you start to feel the weight of some body part.
Yeah.
Then at night when you rest, it goes away, and then the next day you feel fine. In the morning, it starts to accumulate. That sounds like a traffic that is going down.
That's just not lunch, huh?
May not be.
Just
It
for
doesn't
lunch.
usually accumulate at the limbs and body part. Maybe.
So as in your whole body feels heavy.
Yeah, body feels heavy, your arm feel heavy, your leg feel heavy, or even your other body parts, the chest, torso. So if you have breast cancer, for example, your risk area is your chest, your armpits, your shoulder, the back of you, the arm itself. Or if you had men, for example, prostate cancer, they had prostate radiation, pelvic radiation, they will swell from the waist down, including the manly parts. Even the ladies, if you have gynae cancer, ovarian, uterine, cervical cancer, and you have surgery over there below the belly button, and you will swell all the way down from the waist as well as your lady parts.
Wow.
Yeah, and that's not fun at all.
No.
Really not fun at all. Like for men, I have patients that have issues peeing. They can't pass urine, or it will be like a sprinkler, and they have to be in like a bathroom to pee, not the toilet, but a bathroom to pee, because they have to shower immediately or wear a diaper or something
goodness.
like that. It can be really sad.
But you can help them though.
I mean, of course, yes, but it's not pleasant, and not many men will come forward until they can't pee. So a lot of them are very shy about this because it's not nice. And then obviously the men take trauma a lot worse. than women. Women are able to face it and open up a lot easier, and the men they get a little bitter about it and they tend to hide.
Oh, this is so good then. You see, we were talking a lot about women today, and we've learned something about the men and what the men can do and what to expect, and that they shouldn't suffer in silence.
Yeah,
They
yeah,
can get
it's true,
help.
it's true. That there are garments. They can wear compression garments, they can wear cold cushions, that they sell in Thailand. That's really perfect because they can sit on cold seats,
Right.
which will be very helpful, definitely, for female and male.
Yeah, for sure.
This is really different because, we never really hear of cold therapy.
Yeah.
Interestingly enough, it's a very simple, humble thing, just cold therapy. And that sort of reduces and pumps and milk the lymph away, makes the lymph very diluted, it makes the lymph very manageable, because when lymph get heated, it proteinizes, it collagenizes.
Right.
It collagenizes, it gets hard and gets fibrotic and dough-like. Basically, if it's got more water, less protein, protein's like wheat, right? So if you make bread, if you put a lot of wheat, it becomes very dry, right? So it becomes very dry, and then you gotta really knead it. So, but if you put a lot more water, it becomes a very wet dough, and it becomes a very soft, slimy like dough, like a one of those slime dough.
Becomes malleable,
Yeah.
It was interesting because when we were having a little chat earlier about it, you were saying that you do all the modalities that you use are completely opposite of what.
Of
Yeah.
TCM,
Yeah.
of what
So
everyone
I know.
Exactly.
So the ice therapy, all the TCM will be slapping me. So that's just contradiction of the TCM's concept of circulation, because the lymph is not circulation.
The lymph is not circulation.
Lymph is not circulation. Your blood circulation, which your heart pumps 10% of the blood circulation. Lymph is actually beneath the skin, in the fats, below the skin, dermis area, subcutaneous area, before your muscle. And lymph is also found in the visceral lining of your organs, before the organs meshes and the muscles. So basically, this is the target of lymph therapy, and it's not hyping your circulation. In fact, if they actually hype their circulation, they exercise, they sweat, they swell. In fact, it's totally opposite. So this is the concept where people don't understand. Even if they say, oh, you can go and do your exercise, but you swell, then they say, oh, then stop exercise. But it's not positive for you not to have physical activity. It's not
Right.
positive, because you just cannot live your life in a bubble.
No.
You cannot just become complacent, sit there, rot away, because you have a lymphatic risk. So you have to build your muscles slowly, build your lymphatic health slowly, go to the gym, do the weights, then calm it down with a lot of ice, and maybe swimming pool therapy is perfect for lymphatics. Anyone who has a lymph endangerment, if they had any kind of lymph nodes taken, go to the pool. Pool is your best friend. You can do anything in a pool, because it's cool, it has hydrostatic pressure, it channels fluids naturally, higher pressure at the ground, lower pressure at the top, natural lymph drainage.
And I remember we spoke about this when I was coming to see you.
Mm-hmm.
Every time I was hiving, because it felt there was just millions of ants under my skin.
gosh.
That's the feeling. Because you get itchy and you're lumpy. And I used to hop into hot showers.
Yeah.
I thought, this hot shower would just, kill the itch and everything.
Yeah.
She said, no, Andrea, start taking cold
Yes.
showers, cold baths. And since then, I take cold baths because it helped so much. It totally calmed all the hiving. And eventually, it stopped.
But to add to that, I see, full body psoriasis patient at, Dr. Wichai's center, and even some with sores, because the psoriasis is so bad, they start cracking open and they leak out and they bleed a lot. And so one of these trips that I was there, and he was teaching me, he's my mentor, right? So he took the patient to a bathroom and basically showers the patient. He showers the patient. So he puts like normal tap water on him, and then they start rubbing the skin. Even though there are a little bit of sores and wounds, they sort of like just stroke the skin, and I can even smell the patient, from the distance that I was at. Then I see a bucket of ice coming in, and they fill half with ice, half with water, and they start showering the patient with it. They melt the ice, of course, so that it integrates into the water. If not, there'll be ice cubes all over. So basically, the patient starts to say, it feels good. It still feels good. And then they go on and on like that. And in 5 days of that treatment with the ice shower, and then they wrap them with a clean gauze bandage, and they compress it gently and take it out. In that 5 days, you see a total transformation. The skin start to close, the psoriasis starts to clear. And I see this boy who looks like he's 16, and his skin became intact again.
Wow.
So it was really fast, and it was within 3 months, because I was there in April. I saw him in July. He looks almost done. So
my
within
goodness.
that few months, he was almost done. But when he gets cheeky and he eats something that he shouldn't as a vegan, it comes back. So it starts to inflame again. The pro-inflammatory triggers actually sets it back. The inflammations come back.
So protein is not for everyone. Let's just put it that way.
Not for everyone. It may be good for some, but not applicable for people with lymphatic issues.
Right.
For sure.
And underlying health
underlying
conditions.
lymphatic issues, autoimmune diseases, or even skin issues, or even anything that lipidema patients, weight patients, all of those.
Wow, that's fascinating to hear.
I remember when you were treating me, you were also using some essential oils on me. I'd like to get into the topic of essential oils.
Sure.
Because there's this whole camp that says essential oils are bad for you, and then there's another camp that really says, try this. Try the
Which ones are
essential
the
oil.
right ones to be using? Maybe we could talk about that as well, because I know there's so many out in the market, that you don't know where the source is from, and
Yeah.
that can be very crucial to understand
Yes.
before just dousing yourself in it. So yeah, we would love to hear a little bit about
Okay,
the
so-
use of essential oils.
I can only speak for my oils, because I actually have my own brand, which I go all the way to the farms to get. So I travel a lot to Europe, to everywhere. I will meet suppliers from all over the world, even Slovenia, even Australia. I will check out their quality personally, because I am a medical aromatherapist and I study. So because I formulate my own oil blends, and my oil blend works because I study a lot. I had to
Okay.
create a lot. So those are essential quality of an aromatherapy supplier.
And it's important to find good
Yes,
quality.
you need to know your oils. You need to understand biochem. You need to understand basic chemistry. You need to understand what your oil's properties are. You need to understand the profiles and what you're supposed to be expecting from the farmers. And the farmers need to have a lab. They actually have to give you a gas chromatographic reading, a gas analysis of the plant's potential. So they will submit that to me for my verification on whether I want the quality of oils. So that is actually aromatherapy, and not just whatever is the scenting thing in the industry, because those are scents. Scent therapy has its place, don't get me wrong. It's good, nice smell, it has great effects on your psychological health. But if you're going after the medicinal properties of the oils, for example, you need them to be properly distilled at a proper temperature, at a proper harvest.
So what kind of oils can we use? Because you do have such great oils that you've procured and you've disseminated for yourself. What oils can we use to treat lymphatic drainage?
Okay, one of the best oils is grapefruit is itself, because grapefruit is one of the highest in fat dissolving agents. So it actually digests fats, protein fats. So one of my greatest feature in my lymph drainage oil, which I have a drainage formula, is actually high compounds of grapefruit that I buy from South Italy from a direct farm.
And what is it about the grapefruit, though?
The grapefruit actually stimulates digestion biles and actually digests fats. So it actually, when you use it direct on cellulite, and you can use my grapefruit directly on skin, is the cold pressed grapefruit, you'll see that your uneven cellulites will become even. So yeah, in just about 2 weeks.
You know, I love massage, but I
Me
need you
too.
to tell me this because I'm constantly at loggerheads with my husband. I signed up like a $5,000 over massage
God.
package, and I was bruised from head to toe.
Oh no.
Like
my God,
literally
why?
bruised, because they use this rolling pin and this board, and they massage you really hard, and they tell me it's about lymphatic drainage.
Oh my God, what's
So I
that?
So I came home really bruised, and Pierre was very upset. He said, "No, this is not lymphatic drainage. Lymphatic massage should not hurt at all. You know, you should call Veronica and ask her this." So no choice, right? Because this silly woman already spent $5,000, thinking,
Trade in for something else. But
please, yes.
Unfortunately, I hate to say that he's right. So it should never hurt. So lymph is actually the sensitive diva princess, remember? And if your lymph is wrong, it will bruise. It will create inflammation, prostaglandins and all that will increase your lymph production. It actually causes you to swell. You will have inflammation from the bruises. That's why you're red and hot, tender, pain. These are signs of inflammation.
Tender pain, and then for a few days,
Days.
my entire body feels
Achy and
Achy.
sore.
Massages are actually not supposed to feel that way.
You're
Like
not
the fact-
supposed to. So
Okay, well, now I know.
So none of us who train in lymphedema actually do that kind of work. And essentially, lymph is at your skin, dermis, you see? Just for your understanding of where the lymph is. Know when you rub your skin a lot, you get blisters? That's lymph. Did you even bruise? Did you even break a skin? The skin didn't even break, but you get a blister. Even if you friction a lot, you get blister. That's where your lymph is located.
That's quite high up in the epidermis
Yeah,
layer.
yeah, it's
Interesting.
very
Okay.
high up on the skin. So if you really want to push your lymph, and then you bypass the skin and the layers into the muscles and maybe into the bone, you kind of like you went way past the anatomy. You should never have pain. So if in lymphedema class that we take for general practice, let's say not non-lymphedema patient, general practice lymphedema, we cannot even turn the skin red. It will be a fail for us. We cannot even put that kind of layer of pressure on the skin. It will be a fail. We would have failed the class. We will have to retake the exam.
That's a myth. That's a very popular myth that when you're getting your lymph nodes detoxed.
I see my
You-
neighbors
you
slapping
should
their
be in
lymph
pain.
armpits.
Is that good?
Yeah, they are trying
Is that
to
good?
slap
Is this-
their armpit
Is that
to do the lymph massage on themselves, and I'm like, what the
Doesn't-
heck?
so
Should
that
I
doesn't
tell?
work.
Should I tell them? Should I tell them that this ain't right, buddy?
This ain't right. Oh no.
So you're gonna traumatize your lymph structure. Remember, we take out the lymph nodes when we want to treat the cancer, and what happens after you take out the lymph nodes? Lymphedema. So why are you trying to destroy your functional, healthy lymph nodes? Slapping yourself. So I was just, who came up with this idea? But to be serious, guys, it's not
Right.
right.
No.
It's not right. And
Okay.
we do not traumatize our lymph nodes because they are very, very precious. Every lymph node we have, about 800 to 1,000 in our body, is very essential. Even person who loses one lymph node can have lymphedema because you don't know if you have primary lymphedema in the first place. So if you took out one lymph node and you are a primary lymphedema patient who is primary lymphedema is a patient who is born genetically with low functional lymph node, less lymph node, too many lymph nodes that doesn't function, or lymph vessels that doesn't function. You may be one of them, which you never know.
Unknowingly.
Which you didn't know. And if you take out one lymph node, kaboom, and all the doctors will scratch their heads, say, oh, this shouldn't happen. Yes, but you don't know originally this person, do they have 100% function? We don't know. None of us know until we test it.
Thank you so much. We've learned so much today, Veronica. It's
You're welcome.
so
My
great
pleasure.
talking with you. We're on to
Debunking of
debunking
myths.
of myths.
Cold plunging is now all the rage. Is that the answer to all your inflammation woes?
You don't really have to do cold plunges. It is for the brave and strong. Essentially, when you are very hot and your lymph is a hot liquid, sticky liquid, very dense liquid, and when your body is so full of lymph, your temperature differences is very great. So even tap water feels like freezing to you. Yeah, so you don't have to go that cold, like -5 degrees or whatsoever. It's for the people with normal functioning lymph and the athletes. But if you have lymphedema, that might be too much and you will scare them off.
Lymphatic drainage is only for people who are ill or recovering from an illness.
Not really. It's for everyone. So, like I said, before you are ill, preceding to that, you will have lymph accumulation to that organ or the disease profiles. So, basically, like say, for example, breast cancer, before you have breast cancer manifest, you will have tender breast, very bloating breast, fluids all around your chest, axilla that feels really hot. Those would be signs that things are accumulating there. It would be good to drain already. So usually, Dr. Vichai predicts that the sighting of fluids in the MRI, the lymph MRI that he does, if he sighted the lymph MRI around the breast, he gives it about 5-year window before it becomes
Cancerous.
cancer. So you have a huge window to deflect it, to change the direction of what's happening. Yeah, so everyone should have a lymph drainage. Of course, when you are normal functional body, you just need to drain yourself once in 2-3 months. You don't need a monthly or package deal to keep going to detox yourself. Your body naturally detoxes. It's a natural thing. Yeah.
Lymphatic drainage always leaves you tired and sleepy.
It can be. If my patients have chemo and they have a lot of waste material in their body, they will feel very drowsy, because when you do the lymph drainage, it's very gentle work that doesn't even turn the skin red. Okay. And it can be very hypnotic on the nervous system. So it brings your vagus tone up, and your natural auto nervous system will be very high. Your ANS is actually the sleepy reflex that you will have when you are lying down. It brings down blood pressure, brings down your anxiety and stress level. So when you do that, it naturally engages the ANS, the autonomic nervous system. When you do a lymph drainage, the person will feel sleepy, but not like tired and sore and fatigue sleepy, like what Andrea went through.
Okay.
Not that kind of like I'm battered.
I got beaten up.
You got beaten up, exactly.
No need to. No need. Please don't get beaten up. Please protect your lymphs. Lymphs are very important. Even the adenoids, even tonsils, the doctors will tell you that it's a useless piece of thing. But it's very important. These are your throat guardians. I literally fight to the death with my ENT, I'm not sure if he's still talking to me. So that because he wanted to take out my children's tonsils because they had tonsillitis. And I absolutely refused. So I used ice therapy. I put ice chips in their mouths. I gave them ibuprofen, fever medicine, all of that. And passed through. It takes 2 weeks, but you'll get through it. And they didn't fall sick often. You see, so your lymph nodes are the guardians of your body. Your appendix, the guardian of your colon. Your Peyer's patch, guardians of your small intestine. The tonsils, guardians of your throat and mouth. Because these things come into contact with the outside world, the materials of the outside world. So they are needed to diffuse and neutralize the bacteria, neutralize the whatever that you took in or you breathe in or you taste and smell or you ate. So these are important guardians to actually stop all the manifestation of diseases from food.
That's good to know. Hot and cold. So many people believe that drinking hot water is much better than drinking cold water. Is there any truth to this myth? Because I hear that it's much better for blood circulation.
I've seen some videos of people posting like, oh, this person drank cold water, so they died. So it's not true. Seriously, people don't. I drink cold water every day. That's actually cold water in my flask right there because I need the cold. So essentially, yes, you can drink cold water. There's nothing wrong with it because your body is heated. It needs quenching. So why is your body heated? Because your lymph is hot, sticky, inflammatory fluid. So even if you drank a lot of hot water, it will not quench your thirst. So you need to be cold bathing, ice therapy, ice bags, ice all sorts of things for your temperature to drop and you will stop thirsting.
I see.
You drink a bit of cold water, you'll stop thirsting. So another conflicting thing is you need to drink a lot of water. So if you keep drinking 3 liters of water, you're dumping a lot of water and your stomach is stretching, expanding because you keep gorging yourself. And what happens is you're going to balloon your stomach. You're going to cause digestion enzymes issue because you're drowning your enzymes. And then are you peeing 3 liters? Are you actually displacing it or are you storing it? So basically, if your weight keeps piling on, stomach keeps filling up like a water balloon, you imagine that you've been doing that to yourself because that's the perception. So whenever you are thirsty, you're dehydrated, yes, drink 2 sips of water. That's it. Just to hydrate your mouth, your tongue, your throat, but not to dump like have a glass
chug.
of water or one glass of water in at a time. You're chugging it. So you're not quenching thirst. You are just dumping water. You get what I mean?
Yes.
So basically you're just stretching out your stomach walls and you're causing digestion issues. So you say you're bloated. So you say don't feel well. So you can't eat properly because your enzymes are actually watered out by all this. Yeah.
Get it.
Fascinating.
Get it.
So much to learn.
Thank you so much. We've learned so much today, Veronica.
You're welcome.
So
My
great
pleasure.
talking with you. Yeah.
That was fascinating. So much to debunk as well on what people think lymph nodes are. So yeah, maybe we need to have Veronica
have her come back again.
Exactly. Yes, exactly.
Happy to.
Otherwise, thank you for watching.
It's been such a fun time. I love it.
Yes.
Well, thank you so much, Veronica, for your
welcome.
time today.
Thank you for having me. It's been so fun.
Thank you for watching, and one should know, if you have any questions for us, please write in. Any questions for Veronica, let us know. We'll answer your
Just
questions.
try not to kill me.